जनरल सिम्टम, पर्टिक्युलर सिम्टम
अजून
वेगळे करायचे. कॅरेक्टरिस्टिक सिम्टम.
अजून काय असते? तर तेवढंच असतंय. Can others am I audible? Am I visible to all of you?
Yes, sir.
So I am the most sincere student of this class. I will recall what we had discussed in the previous week. So in the previous weeks, we have started the steps of analysis of symptom, steps of repertorization, and that steps of repertorization, we understood the first step of repertorization is analysis of symptom, and this analysis of symptom is very important to complete other steps of repertorization. If your analysis is correct, then your rest of the steps will be correct. And we have understood there are essentially 3 steps involved in the analysis of symptoms, and we also understood the percentage. So categorization of symptoms into mental general, physical general, particular symptom is 50% of job of analysis of symptoms, and the remaining 25% is categorizing the symptoms, each category of symptoms into common and uncommon symptom is 25%, and the remaining 25% is identifying the effect of each symptom on the another symptom. And we understood how to do this categorization with the help of one case. I had also shared a case, and we were discussing in the last week that case, and in that discussion of the case, Suman है क्या?
हेलो, हाँ सर, क्या होगा वह?
अरे रिजवान, अब जरा कौनो बात नहीं, जरा शांति पकड़ो, शांति बने।
अरे हम तो शांति थे, तुम्हें आप ही बोले उधर से क्या चल रहा है?
हाँ तो मैं रुमान को पूछा मैंने।
अरे सर, आपका कैसा हो गया है सर? आपका प्रोनाउंसिएशन कुछ समझ में नहीं आ रहा है। हमको लगा हमको बोल रहे।
अच्छा,
कहाँ सर?
रुमान, I asking questions to रुमान, रुमान।
अरे सर, ये क्या?
ठीक है, अभी रिजवान
अंदर एब्सेंट है।
नहीं, अभी तो एडमिट किया है उसको।
अच्छा सर।
क्या किया था पिछले हफ्ते में रिजवान? लेक्चर कुछ याद है क्या?
पिछले हफ्ते में ना सर, वो बीपीटीपी पढ़े थे सर।
मैंने क्या पढ़ाया था?
आपने सर? वो राज भी पिछले वीक के साथ चला गया सर।
सर तुम्ही हा पेन चालू नका ठेवत जाऊ।
कुठला पेन?
स्क्रीन वरचा
मार्कर। सर ते क्या आहे ना साइडला मार्कर, तिथे कोणतरी काहीतरी सर कांड करतो। हो, मी तुला नाही बोलतो, कळले का? तू नको बोल, तुझं नाम नाही घेतले मी।
मस्त भांडण करता। So I have unmuted everybody, but I have given permission to unmute yourself. 45 participants are there right now. Okay. So in the previous week we are studying this analysis of symptom. We have studied the steps of analysis of symptom, and we have taken one case, and in that case we have understood what are the symptoms in this case. We had made a list of symptoms, then we have understood what are the symptoms on the mental plane, what are symptoms on the physical plane, then symptoms representing whole body, and symptom representing the part of body. And in that symptoms representing the part of body, we have come to the conclusion that there are only one symptom which is referring to the part of the body. Sorry, there is only one symptom which is referring to the whole body, that is chilly, thermal state chilly, and the rest of the symptoms are belonging to the part. And we have reached up to the point of location, and we were discussing what is the location of this case, whether the location of this case is nose or head, or is there is something else. And we had correlated the pathophysiology of acute sinusitis, and we were trying to understand what is the part of body affected in this disease process. And we had come to know that it is not the head which is primarily affected. Primarily, it is affected is a nose and paranasal sinuses. There is some kind of inflammation and infection of this paranasal sinuses, which is giving rise to all these symptoms that are present in this case. So we have understood that the location of this case is a nose, and as the paranasal sinuses are scattered, if you can remember the anatomy of the paranasal sinuses, it is scattered throughout the skull bone. So basically, paranasal sinuses is a cavity in the bone, and the air containing pockets or air containing cavities present in the skull bone. And when this paranasal sinuses are inflamed, they give rise to pain because of there is a common nerve supply to this paranasal sinuses and to the structures overlying that paranasal sinuses. So, any difficulty so far? At this point, if you have any difficulty, ask right now, because this point, what is the part affected, is very important in the further analysis of case. Anybody want to ask something, any difficulty?
No, sir.
No, sir. Then we will understand how these complaints were felt. So that will give us information about the various other parts of the particular symptom. So how the symptom felt, if we ask this question, how the complaint felt, how the symptom felt, now we come across one important sensation. There is a kind of pressing, tearing pain. And so this is the sensation of that symptom. And according to the analysis steps, then we will ask one more question. When this symptom is increased or decreased in the intensity, that will give us the modality. So this pain in the head is more intense when patient lies down with a low head, and it is better when patient is walking. And in the previous week also somebody has asked what is the meaning of dizzy. So dizzy means a sense of whirling, a giddiness. So we have so far followed few steps of analysis of symptom. In this case, we have followed understanding the symptoms, then identifying the symptoms on mental plane, identifying symptoms on the physical plane representing whole body identifying symptoms on physical plane representing part of body, and then we are trying to further analyze the symptoms representing the part of body. They have originated from where, how these symptoms were felt, when it is modified, increase, decrease, etc. Then one more thing is, along with this symptom, what other symptoms have come along with this symptom? Can anybody tell me what are the other symptoms which have come along with this symptoms related to nose and paranasal sinuses?
Associated symptoms.
So what are the associated symptoms of this complaint which is there in the nose and
Stomach
paranasal
pain.
sinus? Huh?
Stomach pain.
Stomach pain is not present in this case. You focus only on those symptoms which are present in the case motherless. Now focus only on the case which I have shared with you in the previous week. Now we are slowly understanding how exactly these steps of analysis is to be meticulously applied to various symptoms present in the case. If you can't remember the symptoms of the case, should I go back and show you the symptoms present in the case?
Yes, sir.
Yes, sir.
Yes, sir. Okay. So these are the symptoms which are present in this case. Read it, go through it carefully. No symptom is left. Hardly 7 or 8 symptoms are present in.
Headache? नाही.
सर एक पण सिम्टम नाहीये.
नाहीये सर.
एक पण symptom is not coming along with the particular symptom. पहिल्यांदा symptom वाचून घ्या. Then we
सर
go
तुम्ही
back to that.
पर्टिक्युलर विचारताय की हेड आणि नोज सोडून.
थांबा, आधी तुम्ही सगळे symptoms वाचून घ्या. Just read the symptoms which are present in the case. Then we'll again go back to that slide. Very small case, but important case. वाचले?
Yes, sir.
हां सर.
Okay. Then we'll go
Sir,
back.
depression.
So, what are the symptoms which are coming along with the symptoms representing the part of body?
नाहीये सर असं कोणतं.
असे कुठलेच
हेडेक
नाहीये.
आणि नोज. हेडेक आणि नोजशीच रिलेटेड आहे.
हेडेक आणि नोजशीच रिलेटेड आहेत, पण मग अजून हेडेक आणि नोजशी रिलेटेड आणखीन काही सिम्पटम्स प्रेझेंट आहेत का?
हो आहेत ना.
कुठले ते विचार दोन सिम्पटम्स?
पण ते पार्टला रिलेट नाही करत ना सर दुसरी. दुसऱ्या पार्ट
डिस्चार्ज.
No. Now,
सर समजलंच नाही तुम्ही
the
काय
heading
विचारताय.
is okay. We go one back slide. Back. So we have understood symptoms on mental plane. We have understood symptoms on physical plane. We have also understood symptoms on physical plane representing whole body is chilly patient. Okay. Then out of all the symptoms, only excluding the chilly and depressed, rest of the depressed and dizzy, rest of the symptoms are particular symptoms. Understood this? Only dizzy, depressed, and
Yes, sir.
is related with the whole body, appearing on the mental plane and physical plane. Now the remaining symptoms. Now we are trying to understand the remaining symptoms, and we are asked the first question: from where these symptoms have came? That will give us location. So we have come out that all these symptoms are which are present in the case, other than these three symptoms: dizzy, depressed, and thermal state. All are related to nose and paranasal sinuses after doing its diagnosis of acute sinusitis. Is it clear so far?
Yes, sir.
Then the next question, what is the sensation of all these symptoms? How these symptoms were felt actually? And we have come to the answer that these symptoms were felt in a pressing and tearing manner. And so these two words or these two sensations become the sensations of this particular symptom. Then we have asked one more question. When all these symptoms are modified, when the intensity is increasing and decreasing in the intensity. So we have got one aggravation and one amelioration. Okay. Pratiksha, is it clear so far?
Yes, sir.
Others can also participate in this discussion. Priyanka Mali, Ruman, Adiba can also participate.
सर मी पण आहे.
But
हा सर, वैभवी आहे. वैभवीचं नाव घ्या सर.
हा ना सर.
ती कधीपासून आन्सर्स देते आणि रिस्पॉन्स देते सर एकटीच तुम्हाला.
तेच ना सर, तुम्ही असं नाइंसाफी करताय माझ्यावर.
हा ना.
Is it clear so far?
हा सर.
Then the fourth question we are going to ask, along with these symptoms which are related with nose and paranasal sinuses, what are the other symptoms have come along with this symptom? Have you understood the question? What other symptoms are present in this case other than the symptoms related to nose and paranasal sinuses? Okay. Now, there are two symptoms which might be called as other symptoms. One is a headache, another is a dizzy spell and depression. So everybody agrees that this dizzy spell and depression, these are two other symptoms not related with nose and paranasal sinuses.
सर हेडेक हे नोजशीच रिलेटेड झालं ना मग, कारण की पॅरानेझल सायनसेस मुळे तर हेडेक होतं ना.
बघा, बाकी what others are saying, that's why I have put a question mark on this headache. Whether the headache is a other symptom or is it part and parcel of complaint which is revolving around the nose and paranasal sinuses? Because this
सर तो
point.
चीफ कंप्लेंटचाच पार्ट आहे.
Okay, good. It is a part of chief complaint. It is a part of nose complaint revolving around the nose and paranasal sinuses.
Yes.
Others, are they with us? What about others? How many of you understood that this headache is not the other symptom? It is a part and parcel of the chief complaint. It is a part and parcel of the complaint which is revolving around the nose and paranasal sinuses. Vaibhavi? Lakshat
Yes,
yete
sir.
ka? Priyanka?
हो सर.
So there are only two symptoms, disease spell and
हो सर.
depression. Then still there are few symptoms which are remaining that we have not categorized under location, not categorized under sensation, not categorized under modality, and not categorized under accompaniment symptom. Now there are three symptoms which we have not categorized under anything. So under location, nose and paranasal sinuses, sensation, pressing, tearing, then two modalities, and the other symptoms is disease spell and depression. So still there are few symptoms are remaining. What are those symptoms which are remaining in this case? Which we are not
Yellowish thick discharge.
yellowish thick discharge. Then there is a pressing, tearing, pain inside out, and then pain starts in the forehead and it goes to occiput. Now, where these three things we should write under location, under sensation, under modality, or under accompaniment. Just give me your opinion. Priyanka, Vaibhavi, Pratiksha.
काय सर?
सर माझ्या मते
हा प्रतीक्षा सांगते आमच्याकडून.
सर आपण हे तिन्ही सिम्पटम्स पर्टिक्युलर मध्येच लिहू ना.
हो बरोबर आहे. These are particular symptoms representing the part of body. But now where we are going to write down these three symptoms? Under location, under sensation, under modality, or under accompaniment? That is my question.
Sensation.
Sensation. Okay, your opinion. Then what is author's opinion? Vaibhavi, Priyanka.
सांग वैभवी.
Same.
हा सर सेम.
Now to solve this question, I have not said whether it is same, whether it is right or wrong. To understand where we are going to write down these three symptoms, we will have to understand a few philosophy of Boning-Hussein. And if we read the philosophy of Boning-Hussein, there are few clear-cut guidelines that what is included in the term location. So what is included in the term location is part affected or seat of disease. Then along with this, side is also included in location, direction of symptom, and extension. So side, you understand, right side and left side. Direction means pain going from right side to left side, pain going from left side to left side to right side, pain going above downwards, etc. These are the directions of symptom. And extension means pain going from one point to another point. So these are the things which are related with location. So where these two things will go, inside out and forehead to occiput. Now after recalling this knowledge, it will go under location. Everybody understood? Those who are attentive to this discussion, how we have concluded that this inside out and forehead to occiput is location. Any doubt? Others, you can also participate in this discussion. I have given permission to unmute yourself. Now this still the yellowish thick discharges, where it will go. Now for that yellowish thick discharges, again we will see the Boning-Hussein's philosophy. What is the broad meaning of sensation? So broad meaning of sensation is sensations and complaint. So all the details of sensation and complaint, all the details, all minute details of sensation and complaints will go under this broad heading, sensation and complaint, to which we are just using this word sensation. And there is one tip, that anything which we are not able to categorize under location, under modality and accompaniment, it will indirectly go under that sensation. It is a negative understanding of the sensation, that anything which is not under location, modality and concomitant, it is sensation. And what is the broad meaning of sensations and complaints is all details of sensation and complaint. It is not only the sensation which are listed or which are considered under this sensations.
सर मग ते हेडेकचं सेन्सेशन होतं ना, फोरहेड टू ऑसिप्यूट, तर त्याला हेडेक तसं मतलब ते सेन्सेशन त्याचं फोरहेड टू ऑसिप्यूट जात आहे, मग तो सिम्पटम आपण सेन्सेशन मध्ये नाही लिहू शकत का?
By forehead to ऑक्सिपुट हे सेन्सेशन आहे का? हे सेन्सेशनचे डायरेक्शन आहे.
Direction.
It is a direction. It is not sensation. The sensation is something is pressing, tearing, and that sensation is first felt in the forehead, and slowly it travels towards the occiput. So it is a direction of that sensation, and so direction of the sensations, direction of symptom is a part of location. Understood?
Okay, sir.
Okay. Others are not responding. It means what? So again,
Nice, sir.
so out of these three categories, we have understood that inside, out, forehead to occiput, these two are the directions. So it will go under location. And where this yellowish thick discharge will go? Now you tell me. Where this yellowish thick discharge will go? Am I audible?
Sensation.
Am I visible? Whether the screen is visible to you, or whether the screen sharing has stopped.
Nose.
Screen sharing दिसतंय का?
हो
Yes,
सर.
sir. दिसतंय.
मला का दिसतंय ना? Okay. Then we will just again recollect everything. That so far we have seen mental general, that is a depressed, okay, and then emotion. So depression is what? Emotion. So physical general is chilling. Now where we are going to classify this dizzy, a sensation of whirling sensation? Just think over it. Then this is the location, sensation, and modality of which we have discussed so far. It is nose, location is nose and paranasal sinus. It is going inside out, forehead to occiput. Sensation is yellowish discharge, pressing, tearing. Modality is aggravation with lying with head low. Modality amelioration by walking, and this all these symptoms have come along with this disease, pale and depressed. But there is still one question. Remember where we are going to categorize this disease spells. Disease spells. Can anybody tell where to? Now this is the 50% of analysis. Where we have categorized mental general, physical general, location, sensation, modality, accompaniment. Are you there with me?
Yes, sir.
So where is this disease spell will go? Where this disease spell will go? Dizzy means whirling sensation. Now where this sensation, how this sensation is produced?
कोणता sensation, sir?
Dizzy. It is a symptom, na? So dizzy is a symptom.
Yes.
What does it represent? It represents mind or body. It represents body. Okay. Then if in the body it represents whole body or a part of body.
Part of body. नाही.
Whole body.
Whole body.
Whole body.
Sir, तुम्ही इथेच सांगतात आम्हाला.
हाँ?
हाँ?
बोला
काय
काय
नाही,
झालं? काही कन्फ्युजन असेल तर विचारा.
Whole body, sir.
Whole body. So
Yes.
where it will go? Under physical general.
Physical general.
Okay. Now this is the 50% of analysis of whole this case. The mental general is depressed. It is belonging to the emotion. Then thermal state is chilly and dizzy. These are two physical general. And then these are the components of particular symptoms which are present in the case: location, sensation, modality, and accompaniment. Up to this, anybody has any difficulty? And I have demonstrated you how all these steps which I have showed to you under this categorization. I have meticulously followed each of these steps, and then we have concluded this categorization of the case number 1. Ankita Jadhav coming very late. Ankita Jadhav, you have come very late. Have you understood? If you have understood, I will end this meeting.
Yes, sir.
And in the next meeting, we will go to the further step of analysis of symptoms. Now you can take the screenshot of this last 2 slides, because that will be required further now. Mental general, physical general, and so these are the particular symptoms, and this particular symptoms we have identified the component.
सर
बोला.
आपण मेन चीफ कंप्लेंट ही हेडेक आणि नोजशी हेड आणि नोजशी रिलेटेड बोललो ना, तर मग तुम्ही लोकेशन मध्ये हेड का नाही लिहिलं?
अच्छा, लोकेशन मध्ये हेड का नाही लिहिलं? गुड क्वेश्चन. का नसेल लिहिलं?
सेम क्वेश्चन.
पॅथोफिजियोलॉजी कुठे आहे? लोकेशनचा अर्थ काय आहे? सीट ऑफ डिसीज ना.
हा सर, नोज पासूनच आहे पॅथोफिजियोलॉजी, बट हेडेक होतं ही पण तर एक चीफ कंप्लेंट आहे ना, तर मग लोकेशन मध्ये हेड नाही येणार का?
चांगला प्रश्न आहे. थोडस
सर मी तिच्याकडून नाही सर, तुमच्याकडून.
नाही, मी देतो उत्तर. क्वेश्चन इज गुड. वाय वी हॅव नॉट written head as a location? We have written paranasal sinuses as a location. And remember, the meaning of location is what? Seat of disease.
मग सर फॉर एक्झाम्पल काही पेशंट्स मध्ये रेफर्ड पेन असतं, तर मग जर लोअर लिम्सची कोणती तरी नवला काही इफेक्ट झाला असेल, तर त्याची रेफर्ड पेन जर वरती शोल्डर मध्ये होत असेल, तर मग सीट ऑफ डिसीज तर मतलब नर्व आहे ना, मग आपण तिथे पण लोकेशन मध्ये लिहिताना शोल्डर मध्ये पेन होते तर शोल्डर न लिहिता नर्व म्हणजे नर्व वाला पार्ट लिहिणार का लोकेशन मध्ये?
So everybody listen to this. Now this is a good question. How to write the location of referred pain? That we will see. But you just write down this good question. How to write down the location of a referred pain? And I think there is only 1 minute. We will end this meeting, and I will explain why I have not written head, and why the paranasal sinuses is the more correct answer, because in the location it is expected you write the seat of disease. It is expected you write the part affected. So in acute sinusitis, what is the part is affected, or what is the seat of disease? Acute sinusitis मध्ये what is the seat of disease?
Paranasal sinuses.
Paranasal sinuses. So it is not the whole head, it is affected. So it is the.
But sir, patient सांगताना बोलतो माझं डोकं दुखतंय.
बरोबर आहे, पेशंट सांगताना सांगतोय.
तो असं तर नाही बोलत की माझे म्हणजे सायनसेस मध्ये प्रॉब्लेम आहे वगैरे.
बरोबर
ते तर आपण डायग्नोज केलंय ना.
हे असं करायचं काम कुणाचं आहे? पेशंटचं आहे का डॉक्टरचं आहे?
आपलंच आहे.
आपलंच आहे ना, मग आपण करतोय ते काम ना.